EGM Network.
Honestly, without TreasureCoast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon, and welcome to Community Conversations. It's so nice to have you by the radio listening to us because we bring such wonderful guests on board that help us understand what's going on in the community, and mostly just a little bit of education to make our lives a little bit better. We know that TreasureCoast Community Health can't possibly do it all ourselves. We have lots of great community partners, and today I'm thrilled actually, to have the VNA staff here because they do something really well that helps all of us in the medical community, as well as you all that are at home listening. So welcome, Lisa.
Thank you.
As a nurse practitioner, I know you have difficult conversations, and probably the most difficult one is about end-of-life planning.
Yes.
So we're going to make it very neutral. You're not talking to any patients directly.
I'm excited too, so thank you, Vicki, for having me, and Candi.
Well, and Candi has been with the VNA, she tells me, for 10 years. I think she must have started when she was like 6. She is very knowledgeable as a social worker. And as I said, when you all sat down, you know, the end-of-life planning is really about getting, to me, over that emotional hurdle of, I don't want to talk about it, I don't want to think about it, and I certainly don't want to have this conversation with anybody else.
Agreed.
Let them figure it out.
Yes.
But that's hard. That's really hard on the family. And there's something we can do about it. So why don't you tell us a little bit about how the VNA...
how we go about that conversation. You know, Vicki, you bring up a great point. And when I start the conversation with families and patients, I always say 100% of us will pass away, including myself.
There's no getting out alive,
including myself. There is no getting out of the world, getting out of the process of the world of passing away. And some of us have a beautiful experience, if you will, of maybe a prolonged dying process, getting diagnosed with a chronic progressive illness, identifying that they're having symptoms that would make us say, you are coming to that ending point. But when we go into the homes, it's a very comfortable outpatient setting. It's not inpatient where there's a lot of lines and different testing, different people, uncomfortable bed or chairs there. It's very comfortable. So when we're able to go into a home, we see patients that we have been identified as needing this conversation.
And really, everyone needs this conversation.
Every single one. Every single person.
As you said, none of us are
getting out of it. So, for instance, my dad went through a cardiac catheterization, very healthy 81-year-old person. But I had the conversation with him prior to that, and he was shocked. Why would I be doing this? And I said, Dad, it's really just a conversation so that we're all knowledgeable on what you want. It's your goal, it's your preference into your end-of-life planning in case that would happen. So when we meet patients there in their home, it's comfortable.
But I think you've just touched on something that we experience when people come into TreasureCoast Community Health. To them, bringing the subject of dying up means, it must be imminent. There's something they're not telling us.
Right.
And that's not it at all.
That's not it at all. It's about having a conversation, planning before or if there comes a chance where the patient can't speak for themselves, and that we give them that dignity and respect that they want and they deserve, even in their dying days.
And, you know, because we're so medically focused, I think we all figure that our death will be something that does go as a planned event, okay? But look at the car accidents. Look at all the things that happen that are totally unexpected.
You're right.
And wouldn't we want the very best for our families? First, the trauma of our sudden death, and then they've got to figure out and try to put aside their grief to figure out what was the last conversation we had about this.
You bring up a great point, Vicki, and I think COVID did that for a lot of us working in the medical field at the hospital, in the hospital setting or acute care setting, or even in the nursing homes. We had these tough talks on FaceTime with families that were really uncomfortable because they were making very emotional decisions, unknowing what that patient really wanted or that person, loved one. So I always bring that up. That gave me a lot of light and hope, saying, this is a great conversation to have before you get there. So we want to prepare for the hurricane and not the tornado. And that's really what I tell patients and families.
So, Candi, what do you think about our, I don't want to call it resistance, but do you see that since we're further and further away from that COVID thing, that people aren't quite as intense about that planning?
I do agree. And I, like Lisa was saying, I like to take it from a perspective of empowering people to make a decision about the way that the rest of their life looks, not necessarily just the end, but people are in all different stages of their healthcare journey or their serious illness, and they need a voice and they need to be educated on options. That's why those goals of care conversations are so important.
Which is a part of the 5 wishes.
Yes.
Yeah. I'm jumping ahead because I know about your booklet.
That's okay. Yeah.
And I think
love
it's
the
just the
5
most
wishes.
wonderful thing.
We
It
do.
is.
It's a great starting point.
And that tool is so helpful. It's one of the many tools that we have that we can introduce easily with not just a patient, but their family member or their friends, and really have an easy opening to that conversation. And you don't have to complete the entire thing at once. You can pick certain parts of that conversation out. We have it on our VNA website. Okay. You can FaceTime with your loved one from afar and open up that document and make it more of a conversation of, hey, I was talking to, somebody from the VNA about this. Hey, what do you think about that? Will you take a look at this for me?
And how many times do those conversations have to repeat before both sides are willing to have that discussion? Because I'm thinking back to when my mother was diagnosed with cancer when I was 40-ish. She was 60-something. And back in those days, if you had colon cancer, it was kind of like, take out what you can. If you can't, go home and figure out your last couple of months. Because there was no chemo. There was no magic pill at that point. And I remember her wanting to have that conversation with me, and I was just totally freaked out. It was like, you're too young to die. That's all my brain could wrap around for a bit. But then she went through treatment. She was thankfully cured of the immediacy. Years later, she was diagnosed with a second cancer, breast cancer. And this time I was very ready. But I think about how difficult it was for me, and I was in medicine.
Right. I usually tell people when they're in it as a family member, whether or not they're a medical professional, you're a subjective counterpart. So you're not maybe able to see clearly or even have those conversations, whether or not it's family dynamics or whatever the case may be. It's like the elephant in the room. Like,
very definitely.
Is it going to happen? Or should, so it's really a pathway to open the conversation up more objectively and then add in their roles, if you will.
And more often. The more often we have those conversations,
she didn't
the
give
better.
up. She was persistent.
And as things change, as your prognosis changes, things change.
Absolutely.
So we need to talk more often.
Yeah, she had a good conversation with one of our physicians at TreasureCoast Community Health.
That's amazing.
So amazing.
Amazing.
That makes such a difference.
For everyone in the family. But speaking of family, most of us have got more than just a child or a spouse involved in those conversations, or should be. And we're all made differently. Yes. And so there are some that are ready to engage faster than others. And as you say, the frequency, it's not a one and done. It's an ongoing conversation.
It's delicate. Very delicate.
But so important. Our family systems all look so differently now. Even, 20 years ago, it looked very different. And we have so many more, distant family members involved, neighbors, friends. We have a community here in Vero Beach, especially. We take care of each other as neighbors. So it's so important to get your wishes discussed and known and written down.
Yeah, that's
With your neighbors and let them know that you're writing it down.
Sometimes too, I feel like if it is a second marriage and there's children involved, it needs to be clearly defined for that person, the one with the illness, so that their wishes are known and they are honored.
And less drama in those final days.
Yeah, exactly.
When I first got married, I wanted to be an organ donor, and my husband was not in favor of that. So we had multiple conversations, and then when we got around to this conversation about end of life, which again, it was high on my mind with my mother. It was really kind of awkward because I told my husband that I wanted my son, one of my boys, to be my surrogate healthcare decision maker. My husband was just really hurt by that. And that was never my intention. I didn't think he would mind because it just made sense to me. Why not to him? So sometimes those things, as you say, if you don't say them out loud and then get them written down, we never had this conversation, right?
100%.
Prevents such hurt feelings or for the experience to be diminished in the end with all the, like you say, drama.
So, and I feel like, statistically, when you look at statistics, people are generally, you can see that maybe only 30 to 40% of people have advanced directives, but actually close to 88 to 90% will be relieved to do them. So when you do sit down with people and you talk about the components of advanced directives, advanced care planning, having advanced directives is one of those things. It's so important. And even the people that are advanced in age, sometimes I'm personally, I would never say, but I'm shocked that they don't have them. But it's also an opportunity for us to give them that peace, that dignity that they can have, knowing that that's completed.
So, Lisa, we're going to take a short break. And when we come back, you can walk us through how easy it is.
I will.
And the components, okay?
Yes, absolutely.
Great.
Thank you, Vicki.
We'll be right back after a short word from our sponsors. TreasureCoast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. TreasureCoast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of coastal furniture on the Treasure Coast. Sofas, love seats, dining sets, and bedroom groups in the latest styles and colors from Four Seasons, Braxton Color, Riverside, Universal Coastal Living, Hooker, Capri, Tommy Bahama, and lots more. We're the outdoor furniture experts and have anything you need for your outdoor living from Lloyd Flanders, Kingsley Bate, Brown Jordan, and Woodard, including a gallery of maintenance-free furniture from Berlin Gardens and Pollywood. Right now, during our Memorial Savings event, we have lots of great half-price specials, including another 10% off on all Tommy Bahama and Lexington furniture in stock or special orders. And all pictures, lamps, and accessories are half price. Sunshine Furniture, 1295 US 1 in the Publix Plaza, Vero Beach. Don't forget to visit our outlet and sales store directly across the street that is filled with name brand closeouts, and visit our website at sunshinefurniturecasual.com.
Blue Dolphin Pools strives to provide quality service with a well-trained staff in the field and in the office. They want you to know that your pool or spa investment means much more to them than just another account. They believe you have entrusted them with your investment, and they'll do their best to see that it stays in top condition. Blue Dolphin Pool has been in business over 35 years, setting them apart from the competition. Residential or commercial, Blue Dolphin will keep you in the swim. 567-5853.
And welcome back to Community Conversations. My name is Vicki Soule. If you're just joining us, I'm the CEO of TreasureCoast Community Health, and we provide primary care at 8 different locations right now, soon to be 9 as we open another location out at 8505 20th Street in the west end of Vero. We're very excited about that. I'm sure you've seen a lot of activity as you go towards the expressway on the south side of that road. It's really cool. And we're really looking forward to having some open houses and then welcoming folks in with both medical, dental, behavioral health. We'll have a pharmacy out front that offers the best deal in town for our patients. And so we're looking forward to that. But we are definitely looking forward with today's guests. I have these 2 lovely ladies from the VNA services. Lisa has been helping as a nurse practitioner there for...
Well, I was there a couple of times. This time, I think I've been there for about 4 years now.
I thought so.
Yeah.
And Candi tells me, as a social worker, she's been there 10 years, a decade.
No.
Over 10 years, yeah.
Yeah,
proudly.
It's great to collaborate with you guys. And particularly today, as we're talking about death and dying, because we're all going to do it.
That's right.
It's not about hospice. It's about we all have an unknown number of days after today. Yeah. And so we need to have our thoughts and preparations for our own peace of mind as well as those of our loved ones, whether they're family, friends, as you pointed out, our neighbors and close associates. Here we have a pretty tight community.
We do.
And so knowing what we would like to have as our final wishes are important. So the VNA just happens to have a booklet called 5 Wishes. Right. Many people incorporate that into their trust as well. But I know that, as you've said earlier, many people come to TreasureCoast and they do not have them. And they kind of infer that it's really not necessary for an outpatient visit. And our staff are constantly going, yeah, it really is helpful. And they're like, are you trying to tell me something? No, we're trying to tell you that it's good planning. Right. Because tomorrow is uncertain for all of us. And so I really appreciate this education on behalf of all of us. Thank you, Lisa.
Thank you.
So how do you begin the conversation? What are the main things that you try to accomplish as a first time?
So when I go into a home, I want to start with a rapport with the family and the patient. The visit is always planned. It's never unplanned. Okay. So I set it up prior to, with family members typically, either on the phone. Sometimes I'll meet with the family first if they can't be there, and then making sure that I have the consent of the patient. But it's very comfortable. So the patient's ready for me as well as the family. And I just introduce myself, talk about my background, talk about, their interests, how they are functionally, where they want to be, what are their goals for the rest of their life? Like, well, how do they see the rest of their life? And how can we obtain those? And are we doing that currently? And does it make sense? Does it make sense?
Can I ask, is this only for VNA patients then?
Well, it's interesting. We typically work within our organization.
I'm sure you have a lot of patients.
I have been approached by lawyers, by community members, by physicians, with patients. I work with Dr. Mistretta. A lot of times he'll call me from the hospital regarding patients that he'll see out inpatient that are coming home that he'd like me to follow.
So like TreasureCoast, you turn no one away.
Yeah. That's exactly because we are very strong with our conviction with this because we want it to be for everyone. We want everyone to have their own say in their plan.
Well, thank you for saying that.
I do. And I say to patients or families, I say, just as we would give a lady or a woman giving a baby, birthing a child, that dignity and respect and honor, we want to do the same for you.
That's wonderful.
And so how can we do that today? And I usually start with the goals of care. What do you see? How do you see? What do you know about what do you know about your health? What do you know about your diagnoses? What do you know about your medications? What do you think they're for? How are they treating you? Are you eating? Are you drinking? Are you walking? What is your quality of life and how does that look for you?
I love nurses.
You know,
Did I mention that?
Yeah. So I really look at the whole person. I don't look at just the diagnosis, because the diagnosis is one thing. But how many hospitalizations have you had in the last year? How has that affected your life? Are you able to care for yourself? Can you shower? Can you eat? Can you drink? Are you toileting alone? All of these things are really, I don't think about them, but I do when I talk about my patients and the care that they're needing. And how is that affecting your spouse, your children, your finances?
Is that where you come marching in as a social worker?
Yeah, and so we really tag team the patient.
And you'd be surprised how many people Lisa sits down with where they have no idea why they're taking a certain medication or what their medical record reads. Some unfortunately have never been formally diagnosed with the cancer that is on their medical history.
Yeah.
And for some, Lisa's the first medical provider to sit down with them and have that in-depth conversation.
Yeah.
This is what this means. Not just you've been diagnosed, but also this is
like, what
this
does this
means.
mean for your life? And what can we do, right? And so I like to work with providers in the community that are, whether or not they're cardiologists, pulmonologists, oncologists, hematologists, whatever the case may be for the patient, to coordinate and advocate for the patient. It's very important that especially our patients that are compromised in any way, whether or not that be they're older and they have multi diseases, or they're been in the hospital for 25 days and there's so many weak, they need an advocate. And so we advocate for them so that we can reach the goals that they have for themselves, and really shed truth and light on what is happening for the family and for the patient. It's so important.
So when they want to put their wishes down, does this booklet kind of walk them through, check this box or these other three?
Yes.
I don't know if
you can fill in as much or as little as you'd like at that time. And you can amend and change things as things change.
And so if an individual was doing that, you had a conversation, family was there, the individual said, I need to think about this some more. And at 3 a.m. they got up and they filled it out. Does it have to be notarized? What makes it official for the family to pay attention?
Not in the state of Florida.
Right.
It doesn't have to be notarized.
Okay.
So you can change it, but that's why
Good
we recommend. That's why we recommend people getting with those loved ones and showing this document to somebody else, and having that as a conversation and showing it to their attorney. And their physician, medical provider. Many of our town is out of town, comes from out of town, comes from out of state. Sorry. Yeah. So, when
different rules.
Exactly. And different things on their medical history from out of state. So it's hard to put those pieces together sometimes. And so we love to be those people to put that together for them.
That's an awesome resource because, as you say, many folks have family outside of town, or maybe they don't have any family at all.
Sure, it does happen.
Saddened to hear how many women, elderly women, have no one left because their spouse passed, they didn't have any children. Their siblings were older or passed before them, and so being able to do that is really important.
Super important.
And that's a part of that conversation that maybe I would have more so, or somebody from my team would be, what is your living arrangement? What are your goals? How has your condition changed? Have you thought about a different living option? Maybe with a higher level of care. Do you have Medicaid? Do you need Medicaid? Things like that. So we can really accomplish a lot in these
a
conversations.
Short time, but really helpful because again, it's like buying a car. If you're not in the market for a car, you hear people talk, you don't really pay attention.
Right, you're so right.
Absolutely.
We're definitely going to have to pay attention to this. So we're almost done. Is there a phone number?
I just wanted to say one other thing.
Okay.
Is that it starts with the goals. Then we get into the living will, right? Okay. We talk about code status. Do you want to be a full code or a DNR? And then we talk about end-of-life arrangements. We talk about donation of organs. And we talk about, and then we revisit all of that.
That is awesome.
So I
Lisa.
just wanted you to know all
I'm
of
going to
that.
have you come back, you two, because we just hit the tip of the iceberg.
I'm
This
telling
is
you.
wonderful.
We can go through the whole thing step by step.
Yes.
All righty.
Thank you so much, Vicki.
Well, thank you all for being here, and I appreciate the listening audience, and we'll be back next week.
Thanks.
Thank you.